It was nearly a year ago when Governor Gavin Newsom, not long into a statewide lockdown, referenced the elephant in the COVID-19 room, herd immunity. The concept was frightening to many. With no vaccine in sight, they feared the only way it could be attained was for the virus to have infected enough people to have run out of hosts. Estimates of the looming toll at the time were chilling, as many as 840,000 Californians dead and 1.4 million seriously ill. National, state and local officials, meanwhile, worked to fend off infection with face masks, social distancing and scaled-back public engagement. That would change life as we knew it, at least until we have herd immunity, the governor said. A year later, with the COVID-19 death toll reaching the 500,000 mark and despite a sluggish vaccine rollout, infection and hospitalization rates are falling dramatically, empowering some officials to declare that partial herd immunity has been achieved. Some say that as many as 1/3 of Americans might have already had the virus and call that the indicator of a waning pandemic. Others argue that partial herd immunity means very little. Only more complete exposure, upwards of 80 to 90%, some say, must kick in before society can exhale in the battle against the virus, they contend. The official numbers that the public watches on state and local dashboards are based on confirmed cases. But many cases still go unrecognized or unreported. Epidemiologists work to calculate what they believe to be true infection levels, factoring in the rate at which the virus is being transmitted and how many people already have recovered. In Los Angeles County, for instance, public health officials estimate that as many 1/3 of its 10 million residents have had coronavirus. Jeffrey Shaman, a lead researcher and infectious disease specialist at Columbia University, estimates that 120 million Americans, 5 times the official count, have been infected. That's just over 1/3 of the U.S. population. I do think that may be contributing to the decline in cases, said Dr. Paul Simon, L.A. County's chief science officer. While overall we think 30% to 40% of the population has had past infection and has had some level of immunity, that's not evenly distributed across the county. There are some places where many more people have had the virus and others where they have not, and there are social networks where many have had infection, so within those networks we think there may be less opportunity and less chance for transmission. In the Inland Empire, a similar trend has emerged. We agree that we are beginning to see what can be referred to as a partial herd immunity effect, said Dr. Corwin Porter, San Bernardino County's public health director. Our county had significant viral transmission in the last several months, leading to many residents having natural immunity to the virus.